How are we today? It's another Friday. This is Learnwithjoes. I'm your anchor, the online education, Dr. Josephine. I'm continuing today the series, Prevention of Suicide, the clearly called Embrace Life. It's so important. It's a germane topic. That's why I'm bringing it to everybody to listen to. Maybe you could episode somewhere. Last Friday, I share with you things you need to know to truly understand suicide, the kind of factors, the complex, numerous factors that contribute to suicidal thoughts. And that was part 4. Today, I'm talking on the part 5 of preventing suicide to embrace life. I'm sharing with you today the part 5, which is the warning signs and risk factors. Warning signs and risk factors. Recognizing the warning signs of suicidal ideation is critical, is germane for early intervention and support. Individuals often exhibit observable behaviors or express thoughts that indicate they may be struggling and contemplating suicide. You just need to watch out for these signs. And they are common warning signs to be aware of. Expressing suicidal thoughts or intent. If you have somebody close to you, a friend, a family member, or just a colleague, expressing or talking so much about suicidal intent, please, just don't take it with laxity. Try to seek help for such a person. Direct statements, talking about wanting to die, kill oneself, or express a desire to end one's life. I'm not talking about acting. If you are in acting, you're an actor or an actress, and you're expressing that in a movie or a drama, that's character you are portraying. But when in real life, you are not acting. You're not an actor. And somebody close to you begin to make direct statement about, wanting to die. If I to die is gain. To heaven is good. Come, express a desire to end one's life. Please, it's time to seek help for such a person. Indirect statements, expressing feelings of hopelessness, being a burden to others, or feeling like there's no reason to live. Drastic changes in behavior. And that's why parents and guardians need to watch very well their children and their words about behavioral changes. Sudden personality changes, like becoming unusually withdrawn, agitated, angry, or excessively anxious. Isolation, withdrawing from friends, withdrawing from family and social activities, and avoiding interactions they used to enjoy. One has to seek help for such a person. Risk-taking behaviors, engaging in reckless or impulsive behaviors without consideration or consequences, or giving away possessions, disposition of belongings, giving away essential belongings, making arrangements for pets, organizing personal affairs without reason. It's not that you are relocating. It's not that you are traveling out permanently. But you just say, no, you are not going anywhere. And yet you begin to, you take my pet, go and take care of it for me. Or giving away a lot of things. One has to be watchful and seek help for such a person. Expressions of hopelessness or helplessness, negative self-talk, speaking negatively about oneself, their future, or their ability to cope with life's challenges. There are challenges, but you can overcome them because the face of life. Feeling trapped, expressing a sense of feeling trapped or like there's no way out of their current situation. Emotional signs, intense emotional states, expressing extreme sadness, expressing despair, expressing rage, irritability, or feeling overwhelmed by emotions. Mood swings, noticeable and rapid shifts in mood from one extreme to another. Changes in sleep and appetite. Sleep disturbances, significant changes in sleep patterns, such as insomnia or excessive sleeping. There's moderation, is it? For someone not to be able to sleep at all, or for somebody to sleep too much. Appetite changes, sudden weight loss, when you are not dieting, or gain due to changes in appetite or eating habits, engaging in risky behaviors, substance abuse, escalated use of drugs, escalated use of alcohol, which can impair judgment and contribute to suicidal ideation. Reckless driving, engaging in dangerous behaviors while driving or participating in other activities that without regard for personal safety or even safety of others around him or her. Making final arrangements, I say saying goodbye, making unusual or unexplained visit to friends or loved ones to say goodbye. Writing farewell notes, writing letters or notes that indicate a sense of banality or closure, preoccupation with death, fascination with death, expressing an intense preoccupation or fascination with death, dying or violent actions, searching for methods, researching or seeking information about methods of suicide online or through other sources, changes in appearance or hygiene, neglecting personal care, showing a decline in personal hygiene or appearance, reflecting a lack of self-care or motivation. You see somebody who is well-dressed before, who used to be well-dressed, and now just wearing something dirty, not caring how we look, looking unkempt, is sign of depression, sign that such a person might not suicidal thoughts. Physical symptoms like unexplained aches and pains, reporting unexplained physical symptoms such as headaches, stomach aches, or fatigue. Recognizing these warnings and signs, taking them serious is very crucial. If you suspect that someone is at risk for suicide or is showing any of these signs, it's so essential to reach out and offer your support. Please, please encourage them to seek help from mental health professionals or a crisis helpline. If you believe someone is in immediate danger, call emergency services if you can in your region for immediate assistance. Please do it. Loss of interest, lack of interest, losing interest in previously enjoyed activities, hobbies, or social interactions, dramatic mood swings, erratic emotional states, sleep disturbances, insomnia or hypersomnia, difficulty concentrating, cognitive impairment, struggling to concentrate, make decisions, or remember important details, chronic fatigue, extreme tiredness, feeling persistently tired, both mentally and physically, without a clear cause. Reconnecting with loved ones, suddenly reaching out to friends or families. I said that before, indicating, oh, bye-bye. The person is saying bye-bye. Or self-harming behaviors, engaging in self-harm, displaying self-harming behaviors like cutting or burning oneself, avoiding responsibilities. When somebody continually neglects his or her responsibilities, decline in academic or work performance, loss of purpose, that is feeling purposeless, loss of hope for the future, hopelessness about the future, expressing a belief that things will never improve or situation is beyond improvement. Heightened anxiety, like a panic or anxiety attacks, hyperactivity or agitation, restlessness, changes in speech or writing. When the person talk or write about death, frequent use of phrases or expressions related to death, dying, or ending one's lives in conversations, in writing, or social media posts. Unsettled affairs, like unfinished business, expressing a desire to settle affairs, such as making a will or finalizing financial matters. I'm not saying it's bad to write a will. And that doesn't mean somebody is going to die immediately. But when that thing comes of a sudden, when you have noticed some changes, and that comes out, then one needs to be very careful. Inability to experience pleasure. Ideation, being unable to derive joy or pleasure from one's enjoyable activities. Giving up on treatment, non-compliance with treatment, stopping prescribed medication or therapy without consulting a healthcare professional. Please, understanding these warning signs can help in identify when someone may be at risk for suicidal thoughts or behaviors. If you are concerned about someone's safety or well-being, it's essential to encourage them to seek professional help immediately. Contact mental health professionals, crisis helplines, or emergency services for assistance. I want to go back to, sorry for that. I mean, I just want to see, I've said it, show this, okay? I think I've come to the end of the presentation. I've come to the end of the presentation. You know, normally I like to present these things so that when I'm talking, you also can read along to understand what I'm saying. But the bottom line are these are warning signals and signs that someone is nursing suicidal thoughts. Please seek help for such a person. I've come to the end of today's discussion, this Friday tonic. Have a nice and wonderful weekend. Before I go, finally, I just like to show you thank you for being with me today. Have a very wonderful weekend.